Do I do this? Okay, we're live, everybody. Thank you. But we are ready to go, aren't we? Yeah. Welcome to this meeting of the Health and Wellbeing Board on October the 7th. My name is Councillor Catherine Del Campo and I'll be chairing this meeting. This meeting is being held in person, via Zoom and streamed live to the public on YouTube. I remind all attendees that participation in the meeting indicates consent to the audio and video being streamed live and acknowledgement that after the meeting it will continue to be available in the public domain. We're not expecting the fire alarm, so if it does go off, please leave in an orderly fashion and rendezvous across the road outside the library next to the fountain. So it'd be useful if all voting members and officers could introduce themselves so that the public are aware of who's in this meeting and the role they're undertaking. So, as I've said, I'm Catherine Del Campo, I'm the lead member for Adults, Health and Housing Services. And as usual, I will invite our Vice Chair, Hugh, to introduce yourself, and then we'll go clockwise around the room.
Good afternoon, Hugh Thomas, Vice Chair of this board, GP in Maidenhead and Clinical Lead for RBWM for NHS Frimley ICB.
Good afternoon, Antiope Duva, Deputy Director of Public Health.
Good afternoon, everyone. Karen Granham. I'm Head of Community Pathways at Berkshire Healthcare Foundation Trust.
Sarah Blackmore, Director of Public Health.
Chloe Plummer, Democratic Services Officer. I'll be clerking the meeting.
I'm Kevin McDaniel, the Executive Director for Adult Services, Health and Communities for the Royal Borough.
Asma Aziz from WAM Get Involved, CEO.
Afternoon, everybody. I'm Martha Early. I'm the Associate Director for Places and Communities for NHS Frimley ICB. Nice to see you. Thank you.
And who do we have online?
We have Amanda Gregory online. Would you like to introduce yourself, everyone?
Good afternoon, everybody. Amanda Gregory, Assistant Director for Housing and Public Protection at RBWM.
Should I go next? Hi, everyone. I'm Councillor Jodie Grove. I chair the Adults, Children and Health Overview and Scrutiny Panel.
And I'm Councillor Amy Teasey. I'm the lead member for Children's Services and Education.
Thanks, everyone. Is there anyone else online that I've missed? No. Okay. So I request that meeting participants do not speak unless I specifically invite you to do so. Once I've invited you to speak, before you do so, well, you've already introduced yourself, so no need to. If any individual attempts to disrupt the meeting, I'm able to use my powers in the Constitution to adjourn the meeting or have the individual removed. To improve our time and effectiveness, please limit repetition, usual stuff. I think we'll now move to the agenda. Thank you. Do we have any apologies for absence?
Yes, Chair, we have an apology from Chris Joyce.
Thank you. Okay. Any declarations of interest? Nope. Okay, minutes of the last meeting held on Wednesday, 2nd of July. Any comments, changes? Okay, do we have any actions? Yep.
Yes, Chair. So let me just pull up the actions. So the previous meeting actions was for Lewis to send over the pharmaceutical needs assessment to Asma, and she was going to circulate it via the Slough CVS newsletter. Was that done? Perfect. So that was done. And then Mark Beeley to circulate the 2025 to 2026 Better Care Fund Health Plan to the Health and Wellbeing Board, and I circulated that. So both actions are done.
Okay, thank you. All right, so next on the list is the pharmaceutical needs assessment. And I think, Sarah, are you going to lead on that one?
Yeah, that's fine. So I'm just going to do a brief introduction and then hand over to Sarah. So just to say, this follows on from the action that we just talked about around sharing the pharmaceutical needs assessment. So I will hand over to Sarah, and we've got some slides, I think. Thanks.
Thanks, Chloe. Yeah, so just one slide to share. Let's move on, thank you. Thanks very much. Yeah, that's it. So yeah, just a short update to confirm that the pharmaceutical needs assessment for 2025 to 2028 has been published and is live on the website. Just to share, we got some really useful feedback from the consultation that ran over the summer, and we were pleased with the engagement. Had some really positive feedback, which is sort of really nice to hear, but also quite a strong theme about the accessibility of the document. So we know that by necessity it's very long because there's a lot of information that needs to be included, but to incorporate feedback that it can be quite hard to follow and difficult to find particular bits of information, we added some more content to the executive summary and put in some more signposting throughout the document to relevant sections that people highlighted were hard to find. And then just to confirm that the date of the next assessment will be in 2028, so it's a 3-year document.
That's it.
Okay, thank you. So that's for noting, isn't it? Because we've already approved it. Yeah. All right, thank you. So next up is the joint health and wellbeing strategy outline draft.
Yeah, thank you. And I'll just start with a huge thank you because I know everyone around the table has been heavily involved in all of this work to this point. So a huge thank you, and to those online too, and others not in the room. So we're now at the point with the health and wellbeing strategy, the joint health and wellbeing strategy, that we've compiled a draft based on input from everybody and through the task and finish groups. We're now ready to take the draft out to public consultation, ready for that to go live on the 13th of October, pending any questions, additional comments from the board today. So I'll just hand over to Sarah again. It's a double act today. He's going to run through a few slides on this one. Thank you.
Thanks, Chloe. We have the next one. Thanks. So yeah, thanks. Just to give a couple of updates since the last Health and Wellbeing Board meeting. So we've been pulling together all the work from the task and finish groups, the community engagement work that's been done, and the first stakeholder workshop that was held in June to bring together the vision, outcomes we want to achieve over the 10-year course of the strategy and principles for delivery. And we've been putting that together into a draft strategy document. We had a second stakeholder workshop in September to review the draft and also to start putting to paper some actions and deliverables for the first year. Really good engagement with the workshop. We had representation across the council and from partners, including the ICB, NHS, Achieving for Children and voluntary and community sector. We've prepared a draft strategy for consultation following feedback from that workshop, which has now been sort of incorporated into the draft. We've been establishing governance for the delivery of the 4 strategic. So as shown in the diagram here, we have a Best Start in Life strategic partnership, which is already existing. We're putting together a neighbourhood health partnership, which will bring together the living well and healthy ageing themes. And then Healthy Place will be delivered through the Place Future Shape group. We'll also be establishing a strategy oversight group, which will help facilitate reporting across the different themes and monitoring and help ensure collaboration as well across the different themes of the strategy. And then just to confirm, we're planning to publish a detailed actions and deliverables plan alongside the strategy document, which will kind of be a living document over the 10 years. So we're sort of intending to review that and update it annually as priorities and needs change. Thanks, Chloe. So yeah, to confirm for next step, so we're seeking approval today to launch the public consultation, which has been proposed to start next week and will run through till December. And that will really give us an opportunity to get more feedback from our residents and community groups and other stakeholders and partners who've not yet had an opportunity to feed in into the draft that we've put together. We've got a detailed communications plan which will be facilitating engagement with that consultation. So we're going to be working with our libraries, our existing networks, using newsletters which goes out to residents and members, and using our partners from the ICB to help disseminate through their networks as well. So we really want to get as much engagement with the consultation as we can. We will then also be formalising the governance arrangements, so establishing that neighbourhood health partnership and ensuring those structures are set up ready for implementation of the strategy. We'll be refining the actions and deliverables plan. So again, working through those governance structures to make sure we're ready to begin delivery in January when hopefully the strategy will be launched. And yeah, just to confirm that following consultation, the final strategy and accompanying action and deliverables plan will be brought back to the hopefully January board for formal adoption.
Thank you. Any comments or questions from the board? Kevin?
Thank you, Chair, and thank you, Sarah and Sarah. I was really pleased to see in the covering report that the consultation has thought about how we might reach the economically disadvantaged, where we know their house. Thinking about that, even in the consultation stage as well as the strategy. So well done. Thank you.
Thank you, Kevin. Anyone else? Yeah, Martha.
Just to also say, fully support the publishing and the full consultation, which is not necessarily necessary, as we know, but a really helpful thing to do in terms of making sure that we can reach our communities. And again, just echo Sarah's point, our call to action around colleagues like Claire and Health Watch, asthma, your voluntary sector contacts, really important that we engage local people in any further iterations so that local people own the strategy. And we've had conversations about some of our wider colleagues, our clinical lead colleagues, who are really keen to support the in the consultation phase as well. So thank you. And the delivery plans, developing those delivery plans. Thank you.
Thank you. And just to add to that, what I would say is that it's been my experience that the feedback that I've given to date has been sort of embraced, enthusiastically. And I know, sometimes, people can be a bit weary of consultations and think, well, ultimately it won't make any difference. I am quite confident that it will. So I would encourage anyone listening to take part in the consultation, because, it does make a difference. So yeah, that's what I wanted to add. Thank you. Anyone else from around the table or online? Yes, Asma.
Just a question around the consultation. In what form will it go out? Will it be just digitally, or is there any other way of access to the consultation?
Sorry, thank you. We'll be sharing hard copies of the strategy document and then also posters in libraries as well as digitally. So yeah. And we can also, if other people have requests for hard copies or suggestions of places we could share that, we'd be happy to.
I was just going to suggest, if you have a social media message, we could send that out and circulate it so people could share it on their WhatsApp pages to be able to access.
Yeah.
No, any more comments from around the table? In which case I'll say thank you very much to the team. And I mean, we've got the public health team, but also everybody else around the table. We've had support from the LGA. It's, really has been a massive team effort. So thank you, everyone. I'm actually really excited about this strategy. Looking forward to seeing what the feedback is from the consultation and actually starting to deliver on it next year, hopefully. So thank you, everyone. What's next? Have we got Sophie? Not yet. Okay. Yeah. So we'll skip domestic abuse for now. Hopefully, come back to that later. So the next thing is neighbourhood health planning, and I think is that you again, Sarah?
Only very briefly, and then I'm handing over to Martha, but yes, it is. Thank you. So I think we felt it was helpful to bring an update on neighbourhood health plans to the board. I know a number of other neighbouring health and wellbeing boards are doing similar. Just headlines really, linked to the national 10-year health plan. There was reference to the development of neighbourhood health plans, and it really does dovetail neatly with the work we've been doing on the joint health and wellbeing strategy. So in terms of the kind of flow of the conversation today, it feels really relevant. It's most likely there will be a kind of strong role for the Health and Wellbeing Board in this space. So again, helpful to just brief board members on what we know so far. There's still a lot of information to come down nationally. So for example, we're waiting for a national framework for neighbourhood health plans this month, we're told. So lots on the horizon, but useful kind of to touch in on this today. But I'll hand over to Martha, and I know we've got a few slides we're going to run through. Thanks.
Thank you, Sarah. Thank you to Councillor Campo. So as Sarah was explaining, the NHS 10-year health plan, Fit for the Future, is our future with 3 radical shifts that the government have set out in terms of hospital to community. Sorry, Chloe, could I have the next slide, please? Thank you. Hospital community to community, analogue to digital, and sickness to prevention. So really promoting that prevention space and having a hospital, with the hospitals community, neighbourhood health services. That's the future ambitions that's set out in that plan. And those neighbourhood health services being designed around local people. Next slide, please. So just a bit of that national context of where it's come from. And neighbourhood health is a relatively, whilst we've been trying to shift care from hospitals to communities, neighbourhood health, or the concept of neighbourhood health is relatively recent, approach by NHS England and the Department for Health and Social Care. And it's really focusing on more care closer to home, closer to where people live in their community. And it's about improving access to services, to health and care services, reducing barriers and reducing any inequalities in health experience that people may have, and improving those outcomes for patients. And the reason for the change was highlighted earlier this year by Lord Darcy. If you're not familiar with Lord Darcy's report, it was an independent investigation on the NHS. And Lord Darcy has a background as a surgeon, so he spoke about the NHS being in critical condition but recoverable. And what he was explaining was that there's rising complexity in terms of local people's needs, and nationally with people living with multiple and complex long-term conditions, and that's increasing. That the system has a lot of fragmentation, and there is some duplication, and siloed working leads to delayed and poorer health outcomes. And what he essentially recommended for NHS recovery was putting patients at the heart of everything, listening to patients' voices and building public trust. And neighbourhood health is seen as an enabler for all of those things. A huge other enabler, next slide please, Chloe, thank you so much, is integration. And neighbourhood health really reinforces the new way of working for the NHS with local government, social care and their partners, including voluntary sector colleagues, where integrated working becomes the norm rather than the exception. And I have to say here in Frimley and in RBWM and Royal Borough of Windsor and Maidenhead, we do have a really strong history and current practice of integrated working, and it's building on that, and we do have a very strong collaboration. For example, the Frimley system is well known for its frailty programme, headed up by Dr. Lucy Abbott. I think nationally recognised as in terms of positive proactive care, keeping people out of hospital. Our local use of the Better Care Fund and integrated schemes, and our local integrated teams, including our local access points. We really have a good culture already that we're building the foundations on, which is really positive here in Royal Borough of Windsor, Maidenhead and across Frimley. And the next slide, sorry, it's got a bit slow on the screen. Thank you, Chloe. So the neighbourhood health guidelines for 2025 focus the first year, this year, very much on complex patients who are using our health and care services the most because they are either frail or very, very complex. And this is all about us working on with those patients and the health and care services surrounding them to avoid hospital admissions. And that's the first year, but the guidance is very much a 5 to 10 year ambition, which is around involving and connecting wider services and focusing on that preventative neighbourhood approach. And just a little bit about what's going on locally in relation to all of that. So we, across East Berkshire, across Bracknell Forest, Royal Borough of Windsor and Maidenhead and Slough, we have been selected to be in wave 1 of the National Neighbourhood Health Implementation Programme, which is really exciting. And there will be a concentrated effort on Slough because the national programme is focusing and emphasising on areas of significant need in terms of deprivation and poorer health outcomes and low health life expectancy first. But the concentrated efforts in Slough will also be that there will be lessons learned and learning across the whole of East Berkshire. So our bid that we put in was very much an East Berkshire bid, signed by all the chief executives across the local authorities and supported by our partners. So it's a really exciting programme. We will be aiming to obviously tackle inequalities, integrate more services around people, concentrate on long-term conditions such as diabetes and reducing the risks of cardiovascular disease and reducing hospital admissions. And in order to do all of that, we recognise that we need to do a lot more around empowering communities and working with communities to solve some of their own health and wellbeing as experts in their own communities. And the next slide talks a little bit more about our local work here in Royal Borough of Windsor and Maidenhead. So Maidenhead Primary Care Network have been successful in the South East regions Accelerator Leadership Programme. So both of these bids for both of these programmes went in the summer period in August, and Maidenhead were also successful for this Southeast Regional programme. And that's much smaller than the national programme. It's a real smaller focus around supporting older, frail people and supporting carers and preventing those carers from going into crisis. And what else can I tell you? Yes, of course, it's around integrated services, as I described earlier, and reducing those the need for those unplanned hospital admissions. And very much using, for example, our wonderful offers of social prescribing locally, which we're very fortunate to have in RBWM, a really good, strong social prescribing offer. The next slide just shows the areas in terms of Frimley, so the Berkshire East Slough bid and the South East Accelerator bid in Maidenhead Primary Care Network for colleagues who are interested in the geography. And the next slide is, of course, covering what Sarah and Sarah earlier covered, the Joint Health and Wellbeing Strategy, how this links in very nicely to the Joint Health and Wellbeing Strategy and its development. And I must apologise, I've probably used an old iteration of the strategy cover because it's now turned blue. The next slide, please, gives you a bit about the governance. And as Sarah was explaining earlier around the governance, it's a really lovely opportunity to bring in a lot of these neighbourhood health programmes because there is a lot going on in this space under the neighbourhood health partnership, which is that circle in the middle on that governance. And the last slide is just around our opportunities, that we have the opportunity to align those neighbourhood plans together, including those programmes of work. We have the opportunity around the national plan, the national implementation programme, the regional programme, but then also the delivery around our health and wellbeing strategy and really making some of those local initiatives work for local people. Okay, that's it. Thank you.
Thank you very much. You mentioned areas of need and addressing inequalities, which is music to my ears because it's something we're very keen on, obviously. How do we make sure, and I'm thinking also, in the context of the NHS changes, new, bigger ICBs and so on, how do we make sure that those smaller pockets of need and inequality that we see in the Royal Borough, for example, don't sort of fall through the gaps?
Yeah.
What can we do about that?
It's an excellent question and a huge challenge, especially, as you say, with the dwindling resources that we all have to our disposal. But I think that's where we really need to be working in that more integrated way across our partners and working with communities. Some of the examples of working with communities, we've been talking this morning, haven't we, where local people have taken the charge to actually identify the need in their local communities and work with the statutory services, but then also through volunteers volunteering and through community programmes have made a world of difference. And we're really looking at a call to action through Neighbourhood Health to our communities to step up and to help in this space.
Excellent, thank you. Sarah.
Yeah, thank you. It's a good question, and I agree with Martha's response. And I guess just to add to that, what will be helpful in the national guidance when we receive it is there should be reference to health and wellbeing boards overseeing neighbourhood health plans. So that means we get a focus on place still within that. And the work we're doing around our joint strategic needs assessment ensures we'll have data at smaller geographies within our place. So again, gives us an opportunity to really focus in on those hidden inequalities that you talk about.
Thank you. And do we know yet whether there'll be any funding to come with this, or not as yet? Kevin.
Thank you. I think that was really interesting. I think there's a lot to evolve. It could be an interesting balance, I think, for us, particularly with our demographics in Windsor and Maidenhead, about how we manage fair and equitable access to services that everybody might expect in a neighbourhood model, while doing exactly what you just described, of enabling neighbours to say this is what matters most here because of that local difference. So I think it'll be interesting to see how that plays out, that balance between the two. But early days, but well aligned. And Sarah, I agree, it's good that national indication are that the health plans will align with the focus of this body rather than there being two things slightly out of step. So that's positive.
Yeah, absolutely. Yeah.
Thanks, Chair. Thanks, Martha, very much for that really interesting and comprehensive presentation. One of the things within Berkshire Healthcare that we've been reflecting on, and I noticed it within your presentation a couple of times, was that integration. So the integration of organisations, of teams. And I suppose just a reflection from some of the conversations that we've been having is to not get distracted by organisations, but to keep focused on what is the problem that collectively we're trying to solve. And then I think that will then help us to make sure we keep focused on those pockets of deprivation. But I think sometimes when organisations or systems are in flux, that's when you can hold on to your organisational construct. And I think that's the time where we almost need to let it go and focus on the problem.
Thank you. Anyone else? Anybody on Zoom? No? Okay. So I think the ask at the moment is that we note this. Yeah. All right. Thank you. Okay. I think we have Sophie with us now, do we? So we're going to go back to agenda item 6. The domestic abuse strategy. Are you there, Sophie?
I am. Can you see me? Can you hear me? It's always a bit strange when you join a hybrid meeting. Thank you. So I've not prepared any slides, I'm afraid. So it's me just kind of talking very briefly about the DA strategy and our annual report. And hopefully you've read that report in your papers. And then I'll just open it up for questions. So I'll just kind of highlight some key areas. And obviously there are some people in the room who sit in our domestic abuse executive group who are familiar with the report already. So our domestic abuse strategy went to Cabinet last December. So we are kind of into the first year really of our new domestic abuse strategy. The annual report really just outlines all the activity and all the work that we have been doing and obviously continue to do as part of delivering that strategy. So on a quarterly basis, we report to the Domestic Abuse Executive Group and our Domestic Abuse Forum. Lynn Ferguson, I can see Lynn in the room, chairs our Domestic Abuse Exec Group. So we provide quarterly updates to the DA Exec in terms of our strategy progress. And then this report is an amalgamation of, that work over the year. So really what I kind of want you to take from the report and kind of note and take away from it is really the significance of domestic abuse and how it kind of obviously interacts with lots of different areas of work, both public health, criminal justice, and obviously safeguarding both adults and children. The impacts of domestic abuse are huge on people's mental health, obviously issues with substance misuse, education, employment, and as mentioned earlier, safeguarding as well. So it just kind of touches upon so many different elements of, services in the borough. What you'll see in the report is there are a couple of appendixes as well, One is a kind of bit more of a detail analysis of what's going on through the MARAC, which is our high risk panel meeting. You'll see as well that it's an East Berkshire report, that part of it. And there's also an appendix in relation to what training we offer and just kind of monitoring the numbers of staff and departments that are coming on that training. But also it pulls into all the different elements of training that other partners do as well, because it's not just what we offer through the borough. The Domestic Abuse Act has been in place now for about 4 years, so it came in 2021. So obviously we still are responding to that, and that is our kind of framework that we align to as well. And I just want to kind of highlight really all the credit to all the different partners that do contribute to the work around domestic abuse in the borough. You know, it's not just one agency responding. It is a partnership approach, and it's really important to remember that and also recognise all the work that is done through the annual report and all the people that are involved with that frontline and strategically as well. So just kind of some key highlight bits from the report is obviously there's quite a lot of data in there, but in terms of our reports that come in from the public to the police, the reporting levels remained fairly stable. So there's not been kind of any huge increases in that. So just over 1,000 incidents reported to the police last year. A very slight increase in our repeat rates, and those are repeat victims who are reporting back to the police with the same perpetrator, and that's within a 12-month period. And again, that will encompass all kind of the different types of domestic abuse, different behaviours, but also different relationships. And again, that's something we really just need to remember throughout all of this, is it's not just intimate partner violence, it can be family members as well. You'll see in there, as I said, there's a detailed section around the MARAC, but kind of highlight data from that is that we have seen a decline in the number of high-risk cases going through to the MARAC. You'll see, though, that there is a kind of strong multi-agency engagement of different agencies identifying that risk and referring into the process. But one of the key things we did last year was to formulate the MARAC kind of QA group across East Berkshire. So that's where that kind of appendix report comes from. It's still a relatively new group, but the Domestic Abuse Executive Group can kind of feed into that MARAC QA group and ask kind of more deep dive questions around the MARAC and its workings and what's kind of going on. But we aim to use that QA group to obviously improve responses around high risk and how the MARAC works. And it just adds that layer of governance as well. Our domestic abuse service is the Dash charity, so they are well established. They've been in the borough a number of years, and there's various data in there, and the work that they do is obviously kind of huge. We obviously commission them for certain services, but then there's other work that they do that is funded through other funding streams as well. Again, you'll see there's been an increase in terms of people phoning in and needing signposting rather than one-to-one support. And in line with the MARAC as well, we are seeing, or they are seeing, that there's been a decline in the number of high-risk IDVA cases that they support. But again, you know, the numbers that do approach them are significant. And again, the highest number of referrals into the Dash charity tend to be self-referrals. So that kind of does demonstrate a good presence and visibility of the service in the borough. And the outcomes that they get from victims in terms of safety and feedback is really strong as well. We do have staff within Achieving for Children who sit in the borough, so they will support victims, and there's also one-to-one perpetrator work as well for those who are known to children's social care. So there's a section in there. And then there's obviously other wider support that's referenced later on in the report too. We continue to do awareness raising, and of course we are coming up to the White Ribbon 16 Days of Activism at the end of November. So there's various plans going on for that, and obviously we did various messaging last year, but we didn't do a big event. But that's something that we're planning for this year later on in November. And just another kind of thing, which I'm not sure is particularly kind of there is reference to it, but suicide prevention and domestic abuse is an area of work that we've been working quite strongly on this last year. And I think kind of going forward, we have got more plans around that and making those links between suicide victims primarily, but also perpetrators might use it as a form of control, and also children who might be witnessing it too. So there's a lot of activity, I think, to come with that element too. And I think those were the kind of key points I wanted to highlight. So I don't know if it's open to questions or if there's anything else people would like to raise.
Thank you, Sophie. Obviously a huge amount of work going on there, really valuable work. So thank you to your team as well. Do we have any questions? Hugh?
It's a comment, Sophie. Thanks for your report. Just to say how well the training you gave was received by primary care well, across East Berkshire, actually, in last year, November 24, I think you did it.
Yes, yeah.
RBWM, and I think you've done it also in Bracknell Forest. And it's really important to raise awareness and how that sort of hit well over 200 people on each of the sessions. So that was brilliant. So thanks for that.
Thank you. And just in response to that, I think I've been approached by another kind of health representative to do some more specific training. And yes, we run, kind of the general introduction to domestic abuse. We do around Marek and Dash, looking at high risk and risk factors and risk assessment. But also a colleague has asked me to do a session particularly around coercive control as well. So I'm going to be developing that as a kind of one-off. But again, if people do identify training needs and I've got capacity or we've got capacity, then obviously we can look to do those individual sessions as well.
I think anything that raises awareness in all those opportunities that we get every day with residents, patients, to pick up some of these signs and encourage people to ask the right questions will be fantastic. So thank you.
Absolutely.
I think that's a really good point. I think, sometimes people are afraid to ask for fear of asking the wrong thing or provoking more abuse. So I think that, that's really helpful. And I know, Sophie, you emailed me yesterday about offering training for counsellors, because we often, we're out and about, we're knocking on doors, we see don't look right. And actually knowing what to do and how to handle it correctly is really important. So I owe you an email, Sophie. We'll come back to you on that. Lynn.
I just want to thank Sophie really for all the work she's done in the borough around domestic abuse. I started chairing the executive group probably back in 2019 when it sort of had disbanded. It wasn't really doing what it needed to do. But Sophie has worked really, really hard over those years to develop really good, and we have excellent multi-agency buy-in. I don't think I've ever attended a meeting that's only got a handful of people. We get lots of people. We get lots of people doing things between meetings as well. So I think it's a real success story for the borough. And I think Sophie probably is the catalyst for all of that. So I just want to
thank you.
I think what we have done over time is really built up the support for children and young people. I think that is really important. And I think the Dash charity working alongside Achieving for Children has been really, really beneficial. So I think it's really a very good piece of work. So thank you, Sophie.
Thank you.
Indeed. Thank you very much. Anyone else? No? Any more questions? Oh, sorry, Asma.
Some great work, Sophie. Thank you very much for the report. Just an observation, really. Many of the communities that we work with, domestic abuse is brushed under the carpet and is not always acknowledged. So we work with lots of faith organisations, community organisations, and I feel that after listening to what Thomas said here about the training, if that training was accessible to community partners as well, just to raise, that would be absolutely amazing. We could set that up if you wanted to work in partnership with us and roll that out to the volunteering community sector across RBWM.
Yeah, absolutely. So my email address is on the top of the report. So if anybody wants to kind of get in touch, as said, and anybody's welcome to join the multi-agency sessions that we run. So for example, we've got a session tomorrow, which I co-deliver usually with an AFC colleague as well, actually. And actually, sometimes the multi-agency sessions, obviously, they've got their benefits as well. And we do encourage more of the multi-agency and just kind of being able to kind of obviously formulate those relationships and see others' kind of point of view as well. So, the last session we did, actually, we had, I think it was about 14 people, but 11 of them were from the library team. And again, that kind of front line, what do we do when somebody comes into the library? And actually, the library are really interactive and really responsive. And I know they're involved in our white ribbon plans for the end of November as well. So, yeah, if anybody wants to email me about the training, we can kind of talk about that. And I do reply to emails. I'm term time and part time, but I don't ignore emails. So, yeah, just email me. And yeah, we're also, as part of the White Ribbon, we're going to be doing 16 days of activism. So we are planning little bite-sized training sessions across those 16 days. So the flyer, we're just finalising the details, but that will go out to my distribution list because I do a quarterly newsletter. So if anybody wants to join the newsletter, then just email me.
Brilliant, thank you. Okay, no more hands up. So I will say thank you very much, Sophie.
Thank you.
See you again soon.
Oh dear, I'll try and work out how to leave. Thank you.
Thank you. So next up, I think we're over to Hugh for an update on the ICB. Thank you.
Thank you. So I've got a verbal update on the ICB collaboration and the transition to Thames Valley ICB. So from the 1st of October, the formal collaboration between Frimley ICB and the Buckinghamshire, Oxfordshire and West Berkshire, also known as Bob ICB, commenced. So this is an important milestone on the journey towards the creation of the new Thames Valley Integrated Care Board, which is planned to go live from the 1st of April 2026. Under this formal collaboration arrangement, the two ICBs are now operating under a formal agreement and will meet together as a joint committee. Their first meeting is scheduled for the middle of November. While both organisations will retain their statutory responsibilities for now, this collaboration allows for shared leadership, joint working and integrated planning. We've had some key leadership confirmations of NHS Frimley and Bob ICB cluster over the last week and some before. So Dr. Priya Singh has been confirmed as the chair of the cluster. Dr. Nick Broughton has been confirmed as the chief executive, and Sam Burrows has been appointed as managing director of Frimley ICB. Looking ahead, this transition will lead to more collaborative programmes of work. It's also worth noting that the government may review the boundary of the new Thames Valley ICB in the future, particularly in response to any local government reorganisation, such as the creation of the new unitary or strategic authorities. There's ongoing work to adjust NHS Frimley's boundaries in Hampshire and Surrey, with a focus on ensuring a safe handover of primary care. Planning's underway, including detailed mapping of place and neighbourhood health forums across Hampshire and the Isle of Wight, and Surrey and Sussex, to ensure that patient care remains consistent and of high quality. So this collaboration and eventual merger are significant steps towards a more joined up care and strategic alignment across our Thames Valley region.
Thank you, Hugh. Any comments or questions? Kevin?
I think more a comment, and thank you, Hugh, for that. I think once again, I think colleagues in the NHS are facing another round of uncertainty. So recognise the importance of continued good communication between all of us in the coming weeks and months to make sure that the individuals involved feel supported and understand how they can work together, while still, as I know they are, putting patients at the heart of everything they do every day. So please do take back our best wishes to those involved, and we'll make sure that we continue to recognise the pressures that people are under as this transition works through.
Thanks, Kevin. Yeah, I echo those thoughts. It's a big change in many areas at the moment, so it's going to be interesting to see how it all turns out. Do we have any hands up online? No. Any more comments or questions? If not, I'll say thank you very much, Hugh. And that brings us very swiftly to the end of the meeting. Future meeting dates and forward plan. Chloe, are you able to talk us through that?
Yep, of course. So our next Health and Wellbeing Board meeting will be on the 19th of January, 2026, very scary. Our substantial items are the Joint Health and Wellbeing Strategy, as it will be ready for publication then, I'm sure. Then the JSNA, we're going to hear from the Better Care Fund, and then standing items, the Neighbourhood Health Plan update and forward plan. And that's all that's on there for now. Anyone has any comments?
Fantastic. And yeah, I'll take comments. Kevin?
Thank you. I just wanted to make a comment because normally we have the Better Care Fund as a standing item. We've worked with colleagues, both from Princeton colleagues in the NHS and adult colleagues. There's quite a significant, with the change that Hugh's alluded to, there's quite a bit of change coming about how we use that money. So what we've chosen to is not bring a standing item today, but in January, a chance to look at where's the direction of travel, what's that looking like, and hopefully the chance to dig into it in a bit more detail for this board next time. That's why there's been a change. Those who look at the panel and say, we normally get an update on run rate. There's significant changes coming. We want to make sure we give that good time next time.
Absolutely. Okay, any more comments or questions? No, everyone seems happy. No hands up online. I was going to add something and I've completely forgotten what it was. Oh, no, I was just going to say, you know, obviously, you know, if you have things that you would like to bring to the board as well, you know, please do get in contact with myself or with Chloe or Hugh or anyone, and we'll consider those for the next meeting. I can't believe we're talking about 2026 already. That is quite terrifying. Thank you everyone for your time and for your engagement, and yeah, have a happy Christmas.